my name is Gagandeep Gill. I'm going to be your student FNP today. I'm going to be doing your musculoskeletal exam. Do I have your permission to record this video for my professor? It's going to be uploaded on YouTube for grading purposes only.
Yes.
Thank you so much. Let me go and wash my hands. Perfect. Alright, so today for the musculoskeletal exam, we're basically going to be checking, starting from head to toe. We're going to check everything. I'm going to go ahead and start off by looking at your hands. That's the first thing we're going to check. So I'm just looking for any deformities, anything abnormal about your fingers, if they're, anything that should be a concern to me. There's no swelling. I don't see any swelling. For the sake of the video, I do want to mention that with this test, you would be performing everything bilaterally, but for the sake of time and for the video only, I might be performing each of the exams or, assessing like one side versus the other. So I just wanted to let you know that you would compare both bilaterally. They're the same. I see no swelling. I see no deformities. I don't see any redness. Let me go ahead and look at your hands this way. I don't see any muscular atrophy anywhere in your hands either, and I don't see any joint, I see joint symmetry, so nothing abnormal. Next, what I'm going to do is I'm going to go ahead and start off by palpating your hands. So I'm going to go ahead and take your hands, and I'm just going to do each finger at a time. I'm just checking to see if I feel any nodules, if I feel any tenderness. If you feel any pain, please let me know. I'm just going through and checking the distal and the proximal interpharyngeals. I'm going in between all of them. And then I'm going to go ahead and palpate for the metacarpal phalangeal, and I'm just going in between your fingers for that. I don't feel any nodules, there's no tenderness, and the patient's not reporting any pain. So that's good. Next, what I'm going to go ahead and have you do is I'm going to go ahead and have you make a fist with your hands. You're going to go ahead and, make a fist that shows me that you have strength, bilateral strength. And go ahead and flatten out your hands. Perfect, just like that. And then go ahead and move your fingers, just like that. You want to flex and extend all your fingers. Yes, just like that. Both hands bilaterally. And I'm going to go ahead and have you abduct and then adduct your fingers. Perfect. So that completes our hands. Next, we're going to go ahead and move it. So you want to do just with your fingers, not with your entire wrist. So now we're going to go ahead and move down to your wrist. Again, I'm just assessing for any deformities. I'm checking to see if both of her wrists are bilaterally equal. I'm going to go ahead and turn to the posterior side. I'm just checking to see if I see any deformities. I don't see any deformities. I don't see any muscular atrophy either here. And then I'm going to go ahead and start off by now palpating the wrists. And I'm going to go ahead and go in between, including the metatarsal and the carpal bones of the wrist. And I'm just checking basically both sides. I'm going to go ahead and do the same thing here. I'm just checking for the metatarsal, metacarpal, and the carpals. I'm going in between the wrists. Perfect. So now what you want to do is you're going to go ahead and flex your wrist to a 90-degree angle downward, just like that. And then now you want to go ahead and flex it up. Yes, this shows me that she has flexibility in both of her wrists bilaterally. There's no pain, no tenderness reported by the patient. So both of your wrists are good. And then I'm going to go ahead and have you move your wrist to your ulnar, which is outwards, and then to your radial, which is inwards. Yep, just like that. Perfect. So this goes to show me that she has 90-degree flexibility and extension, but with bilaterally both wrists. We're going to go ahead and do a specialty test here for the wrist. And the first one we're going to do is the Tennell's sign. Tennell's sign is where you hyperextend the wrist, and I'm going to go ahead and tap on the medial side of it. So you're going to go ahead and keep your wrist just like that. I'm going to go ahead and tap on your wrist. You would normally tap, and if the patient reports any pain or tenderness, this would indicate a positive Tennell's sign. Do you feel any pain? Go ahead and relax your wrist, just like that, Okay. Any pain? Okay, let me go and do it to the opposite side. Any pain? Okay. So this shows that she's not reporting anything abnormal. This is a negative test. Next, we're going to go ahead and move down to, it's called a Fallon's test. For the Fallon's test, you want to go ahead and do this and raise your elbows about 90 degrees. You still want to keep it just like that. And what you want to do here is you want to apply a little bit of pressure, and you're going to tell me if you feel you're flexing your wrist at 90 degrees. That's perfect, just that way. And you want to tell me if you feel any pain, any tenderness, anything abnormal, anything bothering you. You would normally hold this for about 40 to 60 seconds. But for the sake of time, for the video, we're going to go ahead and just do it for just a few seconds. And then since the patient's not reporting any pain or tenderness with this test, this is going to be a negative Fallon's test. Perfect. Thank you so much. You can go ahead and relax. All right, next we're going to go ahead and move down to the elbows. Go ahead and lift up both of your sleeves for me. Yep, you can lift that one as well. And here what I'm doing is I am just checking for any pain, any redness, anything that the patient reports. I'm going to assess both of her elbows bilaterally. Both of her elbows bilaterally are, there's no redness, there's no deformities, they're bilaterally both the same. Symmetry is the same on both sides as well. And I'm going to go ahead and start off by palpating now. I'm going to go ahead and just palpate. I'm going to go ahead and check for the ulnar surface, which is on the inside of her, medial side of her elbow. And I feel that right here. I can feel the olecranon process, which is the pointy process right here. And I'm pressing on the lateral side of the epicondyle. And then I'm going to go ahead and move down to the medial side of the epicondyle. And I'm feeling for any nodules, any pain or tenderness. I don't see her getting any kind of discomfort, so I'm assuming that there's no pain. On the medial side of the epicondyle is where the golfers, or the golfers of the baseball, is indicated, and then for the lateral side is where the tennis elbow is. So the tennis is on the lateral side, and then the golfers is on the medial side. Once again, I don't feel anything abnormal. I'm going to go ahead and just do the same thing on the opposite side. I'm feeling for her ulnar surface. I can indicate where her olecranon process is. I can feel for that. I'm going to move up to the golfer's elbow. And then on the lateral side, I can feel for the tennis elbow. Again, no deformities, bilaterally equal, same on both sides. Thank you for that. And then now I'm going to go and have you just flex your elbows, and then you're going to go ahead and extend your elbows. Perfect, just like that. And then go ahead and supinate your elbows just like this, and then you're going to go ahead and pronate. Yep, supinate, pronate, just like that, yes. Keep on going. Perfect. So this indicates to me that she has flexibility in both of her elbows as well. So next we're going to go ahead and move down to or up to the shoulders. And I'm just checking, I'm actually assessing first. I'm inspecting for any swelling. I don't see any swelling. I don't see any deformities. I don't see anything abnormal. There's no atrophy. There's no joint symmetry. Joint symmetry is bilaterally equal on both sides, but I don't see any nodules, anything abnormal, or any kind of anything that sticks out to me that's not considered considered an abnormality. Next, I'm going to go ahead and just palpate. For my patient's privacy, I'm going to go ahead and just leave her sweater on, and I'm going to go ahead and just palpate her shoulder. And what I'm looking for first, I'm going to start off by finding her clavicle bone, and I'm just going to follow that, and wherever it gets to the pointy, or that pointy sides that bulges out, that's where her acromyoclavicular joint is. And right after that joint, I'm going to go ahead and move down to her shoulder. That's where her bicep groove sits, and I can feel her bicep groove pretty well since she's lean. And right next to that is where her tubercular of the humerus lays, and after that is where her coracoid process is. So after the coracoid process, I can kind of feel for the subdeltoid bursa as well, and I'm just palpating all of these areas. I'm checking for any fluid, any access, any pain or tenderness that the patient reports. I would do the same thing on the other side, but for the sake of time, I'm just doing it on one side. Since the patient didn't report any pain or tenderness, so we're going to go ahead and move down and we're going to do her range of motion for the shoulders. So what you want to do for your shoulders now is you want to go ahead and just bring your shoulders all the way up to 180 degrees. And now you want to go ahead and push them back to about 60 degrees. And any pain, any tenderness. Okay, bilaterally I see her scapula, positioning is bilaterally the same. There's nothing that is abnormal. Her scapular motion seems to be intact and in range. Both with straight arms behind her is where, that's good. You can go ahead and relax. Next, what we're going to do is I'm going to go ahead and do with your arms at your side, we're going to go ahead and adduct and abduct. So you're going to go ahead and put your arms right here. You're going to go ahead and do abduct. And then you're going to go and do adduct. Perfect. So go ahead and keep on going, 90 degrees, and then bring it all the way down. Keep on going. Tell me if you feel any pain, any tenderness, anything abnormal, anything sharp hurting you on either of those sides. Okay. Next, I'm going to go ahead and just have you place hands both on the the internal rotation. So you're going to go ahead and take one of your hands, and you're going to go ahead and put it on the back. You can do it one at a time. And you're just going to put it on the back of your scapula, where your scapula is, just like that. And then we're going to go ahead and do, that's called the internal rotation to 90 degrees. Next, what we're going to go ahead and do is an external rotation. This is where you take your, you can do the opposite or the same arm, and you're just going to go ahead and do up. Yep. Just like that. You can relax this arm. Yeah, and then this is called the external rotation to 90 degrees for your shoulders. Perfect. You could go ahead and relax. The next test we're going to do for the last one for the shoulders is a specialty test, and we're going to do the empty can test for this. And what you're basically going to do is you're going to bring your arms out in front of you. You're going to pretend like, and you can take your thumbs out too, you're just going to pretend like you're emptying out a can. Just like that. Keep it very still. I'm going to go and apply a little bit of pressure. Try to resist against my arms, just like that. Any pain or tenderness? Perfect. So this indicates that the patient doesn't have any rotator cuff tear. You can go ahead and relax. That's when we would normally do this test, and there's no supraspinatus. There is supraspinatus strength, which is all right here. Perfect. So next we're going to go ahead and move up to your head and neck. And assessing your neck and your head, I don't see any deformities. I don't see anything abnormal. Your posture seems to be good, and then also I don't see that you are complaining of any pain or any tenderness. I don't see any redness, nothing like that. There's no swelling observed either. So I'm going to go ahead and just kind of check for your TMJ tenderness. It's basically going to be at your jaw. I'm going to go ahead and have you open your mouth. Close it. Perfect. Open it again. All right, close it. Any pain or tenderness? Okay, so patient doesn't report any tenderness or pain with our TMJ. That means, your TMJ is probably healthy. I'm going to go ahead and move down and palpate your sternoclavicular and your cervical spine. And that's all right over here, your paracervical muscles, which is on the back of the neck. I see, and then also your her trapezius muscles and the rhomboids, and any pain or tenderness. Perfect. So her sternoclavicular, her trapezius muscles, cervical spine, and paracervical muscles were all palpated. Patient doesn't report any pain or tenderness with those. I'm going to go ahead and move down, and we're going to do the range of motion for your head. So what you want to do is take your chin, and you're going to touch your chest with it, and then go ahead and look up, and then go ahead and look to the left, and you're going to go ahead and do to the right, and then you're going to make a big circle slowly. Any pain? Any tenderness? No? Okay. All right, and then I'm going to have you open your mouth, and then you're going to go ahead and take 2 of your fingers and just put them in the middle, or 3 of your fingers, and just put them in your mouth, and do that. Perfect. Okay, so this actually checks for any lateral movement. You can go and take your fingers out of your mouth. This checks for any lateral movement with the mouth open, the jaw. I'm checking to see if she complains of any pain or tenderness, anything abnormal, nothing that's indicated as of now. And then now we're going to go ahead and do a specialty test. It's called the Sperling's test. With this test, we're basically checking to see if you have any, like a serious head or, shoulder, right here, head and neck injury. So I'm going to have you just go ahead and look straight for me, and I'm going to apply some pressure, and you're going to go ahead and resist and kind of move toward your head toward my hand. Yep, just like that. And then to the left. All right, perfect. Thank you so much. This is a Sperling's test as indicated of negative. She would have reported some pain or tenderness or told me that she can complete this test if, it was a positive test. Next, we're going to go ahead and move down to your feet and toes. If you can just bring out your feet and toes for me, just like that. And then I'm basically checking for any deformities with her toes or her feet. I don't see anything, and I'm just looking to see if there's any swelling, if bilaterally both of her toes are, both of her feet are bilaterally the same, and I see symmetry on both sides. I'm going to go ahead and, can you just scoot over just a little bit? Yes, thank you. I'm going to go ahead and just start by, I'm checking for any calluses. I don't see any calluses. When she's standing, I'll go ahead and check for it. That's when I would normally check for the flat foot. That's best when you can see it, but since she's sitting down, I'm going to go and just do all the tests sitting down, and then I'll have her stand up whenever we're doing the spine, and I'll check for the flat foot then. So I'm going to go ahead and I've checked for any, there's no bunions, there's no plantar warts, I don't see any, nodules. I'm going to go ahead and start by palpating her interdigital neuromas, or check for any interdigital neuroma. I'm just palpating, going through all of her phalangeals here, interphalangeals and metatarsals, and I'm just checking. Normally between the third and the fourth digits is where you can feel for that interdigital neuroma, the Morton's neuroma, but I don't see anything here, or I don't feel anything here. And I'm just checking to see if she has any plantar fasciitis. I don't feel anything. I don't see that the patient's reporting any pain or tenderness. I'm going to go ahead and check for, I'm just moving down. I'm going to go ahead and do the same thing to the opposite side of her, to the other foot, and I'm just checking the distal and the proximal interphalangeals and the metatarsals. I don't see that she is reporting of anything like that, any pain or tenderness. So I'm going to go ahead and have her, we're going to do range of motion for her toes. Can you go ahead and, bring out your toes like this? Yeah, flex your toes, and then go ahead and curl your toes. And then invert your feet like this. And then evert your feet, I should say. Perfect. Thank you so much. This completes our feet and toes exam, and then we're going to go ahead and move down to the ankles. And I'm checking her ankles, seeing if there's any deformities, seeing if there's any nodules. I don't see any nodules. I don't see any discoloration. I don't see any swelling. So after inspecting her feet, I'm going to go ahead and check for her, palpate her ankles. And I'm just palpating her medial malleolus and the Achilles, which is at the gastrocnemius right back here. And I'm going to go ahead and palpate her lateral malleus. Any pain or tenderness? Patient doesn't report any pain or tenderness, so that means there's nothing serious that we need to take into consideration here. I'm going to do the same thing to the opposite side, medial malleolus, lateral malleolus, palpating. I'm checking for any fluid buildup, any swelling, any pain or tenderness. And since she doesn't indicate of any of that, we're going to go ahead and do a range of motion. And I'm going to go ahead and check for, do it actively and passively. So I'm going to have her just push against my hands. Perfect. Push against my hands, and then go ahead and try to pull up. All right, and go ahead and try to pull up. Perfect. And then we're going to go ahead and have you flex your ankles, and you're going to rotate, make a big circle. of your ankles. Yep, just like that. Make a big circle and then bring your ankles in and then bring your ankles out. Perfect. So that completes our ankles exam. We're gonna go ahead and move up to your knees now. And here I'm just checking for, I'm gonna, again, inspecting for any swelling, any deformities, any discoloration. I don't see any of that, so I'm gonna go ahead and start by palpating. And I'm just palpating. I'm gonna palpate both of her knees bilaterally, and I'm palpating and finding the suprapatellar suprapatellar space. I see that, or the pouch. It's right here above her knee, and I'm going to go ahead and palpate the sides of her patella, and I'm going to go ahead and go to the back of her knee, and I'm checking for the popliteal fossa, where the popliteal fossa sits, for any Baker's cyst. Again, I'm going to do the same thing to the opposite side, or the other knee. I'm just feeling for her suprapatellar knee, and then I'm checking for palpating the sides of her knee, and then I'm going to go ahead and feel for the popliteal fossa for any Baker's cyst. I don't feel anything abnormal. There's no swelling. I don't feel that the patient reported any pain or tenderness. This indicates a negative, or that we don't have anything going on here. I'm going to go ahead and have you, can you flex your knees or bend your knees all the way, both of them? Perfect, just like that, and then go ahead and bring them out. All right, so I just had her extend her knees from 0 and then flex her knees to at least 120, and she was able to do that without any indicating any pain or tenderness. We're going to do a couple of 5 of the specialty tests here, and let me just have you lay all the way down. Okay, and let me give you the pillow so you're comfortable. All right. Okay, so what we're going to do here, the first one we're going to do is the valgus stress test. The valgus stress test is where I go ahead and have her bend her or flex her knee about 20 degrees, and I'm having her flex her knee about 20 degrees, and I'm just taking her, placing my hand on the outer or medial side of the foot or the ankle, and then I'm placing the hand that's going to be on my knee on the lateral side, and I'm just going to kind of basically abduct the lower leg to see if she reports any pain or tenderness. Okay, this is a test that you would normally use for an MCL tear, or to see if there's anything abnormal with your MCL, meniscus, and the patient doesn't report anything like that. So next we're going to go ahead and do the Vargas stress test, and that's like opposite. It's basically the same thing. I'm going to go ahead and place my hand that's supposed to be at the ankle on the outside of the ankle, and then I'm going to place my left hand that's supposed to be at the knee. I'm going to place it on the inside of the knee. And again, same thing. I'm just kind of applying some resistance to see if she reports any pain or any tenderness. Since she doesn't indicate of any of that, this is also a negative test. You would normally do this on both sides, but for the sake of the time, we're just performing it to one side. The next test is going to be the Lachman's test, and for this test I'm keeping her, I'm going to go ahead and have her flex her knee slightly, again 20 degrees where it was before, and I'm just taking one hand, I'm going to stabilize the femur right here, and I'm going to take the other hand, I'm going to stabilize or hold it above the tibia, and I'm just trying to apply some pressure, and I'm bringing her, pulling her tibia and her femur in, and I'm just going to go ahead and kind of take it out, applying any anterior, checking for any laxity. I don't feel any laxity. I don't feel that the patient's reporting any pain or tenderness. So this is also a negative test, indicating that her ligaments are healthy, or they're, nothing abnormal with her ligaments. The next test we're going to do is the George test, and for the George test, it's basically checking for the same thing. It's checking for the ACL, just like the Lachman's test, and Lachman's test is considered a little bit more sensitive versus the George test. For the George test, I'm keeping her knee actually at 90 degrees now, and I'm going to have basically I'm gonna sit on her, or I'll put my knee on her foot to kind of stabilize it, and we're just checking to see if I'm gonna grab the upper leg, and then I'm gonna pull it anteriorly and then posteriorly to check for any laxity. And I don't feel that the patient's reporting any pain, any tenderness. Again, this test is for ACL. Normally, Lachman's test is considered a lot more probable, a lot more reliable than the Joris test, but this is also another test that you can do. So after this test, we're going to go ahead and move down to the McMurray's test. McMurray's test is where we are going to like medially rotate the tibia and extend the knee. So I'm looking and I'm basically feeling for any crepitus, and I'm just going to have her, you're just going to take your tibia and you're going to do this. Any pain or tenderness? Okay. You're just going to rotate your tibia just like this. I'll go ahead and help you. Just go ahead and rotate it, and then go ahead and rotate it the other way. Okay. And the patient doesn't report any crepitus and any pain, so McMurray's test is also negative. Okay, now we're going to go ahead and move down up to her hips now. And this is where we're going to go ahead and check for any swelling. I don't see any swelling. I don't see any nodules. I don't see any redness. There's nothing abnormal after inspecting it. I'm going to go ahead and move down and palpate her hips. So I'm going to go ahead and have you move to your side. Can you face that way for me? Just like that. Perfect. And then I'm basically feeling for her hips right here. I'm checking to see where the greater trochanter is. That's like the big pointy bone right here on her hip. And after checking that, I'm basically seeing if I can find the anterior superior iliac spine, the ASIS, which is right here. Sorry, is that painful? Okay, so I'm just palpating it a little bit, and then I'm just checking to see where the posterior superior iliac is. I feel that right here, and then right below it is where I feel the sacroiliac joint. So I feel all of, I'm palpating all of these. They don't seem, the patient doesn't report any pain or tenderness. This just goes to show that it is a healthy hip that we're, feeling for right here. This completes our palpation. Normally I would complete it on both sides, but for the sake of the video, again, just on one side. Go ahead and you can straighten out on your back again. On your back. Yes. Perfect. So now we're going to go ahead and perform some range of motions. And for the range of motion, we're going to go ahead and have you flex your knees to about 45 degrees internally and externally. And we're just going to rotate like your knee just like that. Can you do that on your own? Perfect. Just like that. And then can you do it to the other side? All right. Okay. And then can you bring your knees toward your abdomen? Perfect. And then go ahead and take them out. And then can you go ahead and bend your knee? And we're going to go ahead and do the abduction and adduction of the hips bilaterally. You're going to go ahead and extend, and then you're going to go ahead and bring them closer. Perfect. So I'm going to apply a little bit of pressure, try to open up. And then, perfect, okay. And then I'm gonna go and apply a little bit of pressure, go and try closing. Perfect. So bilaterally, patient's hips are strong, and there's nothing abnormal indicated of her hips. We're gonna go ahead and do two specialty tests here. The Thomas test is the first one. With the Thomas test, what I'm gonna have her do is I'm gonna have her flex her right knee and pull it firm against her abdomen. So you're gonna go and hold your knee and then pull it closer to you. Perfect. And this basically, I'm just checking and assessing the bottom of her hip. I'm checking to see if she complains of any pain or tenderness. She's not indicating of anything. Go ahead and let go. And this is a negative Thomas test. Next, what we're going to do is I'm going to go ahead and have her do the Fabber's test. For the Fabber's test, we're just doing the flexion, abduction, external rotation, and the to test for any hip scoliosis. And I'm going to have her place her left foot is going to go to her right quad. So what you're going to do is you're going to go ahead and do this, and you're going to apply a little bit of pressure. I'm just going to have it, go ahead and bring it down. Perfect. And we're just going to apply a little bit of pressure, gently and firm pressure. And since she's not reporting any pain or tenderness, this goes to show that she doesn't have any tenderness or pain, any fluid buildup or anything like that in her posterior hip or back. So this completes our hip assessment. Next we're going to move down to the spine. So I'm going to have you stand up for me. You're going to stand right over here, and as she's standing up, I'm also going to be assessing. You're going to face me. I'm just go ahead and I'm checking to see if she has that flat-footed that we asked about in earlier, and I don't see that anywhere in her feet. So go ahead and bend down this way, and you're going to go ahead and just bend this way. Perfect. And I'm just checking her. I'm assessing her spine here. Or actually, can you do me a favor? Can you move a little bit more that way? Perfect. And then go ahead and bend. All right, and I'm just checking to see if there's any signs of scoliosis here. She is in her early 20s, or almost in her early 20s. So I'm just checking to see for that. I'm checking any deformities. I'm going to check for any swelling, anything abnormal. I don't see anything here. So, and bilaterally, her spine looks, and her posture looks equal. I'm gonna go ahead and use the ulnar side of my hand. I'm just gonna palpate her spine. And I'm just checking to see if I feel any nodules, and I don't feel anything abnormal. I'm just applying firm pressure. I don't see any like fluid buildup. I don't see her complain of any pain or tenderness. So you can go ahead and stand up. So this indicates that she has actually a pretty healthy spine for the most part. And then after we checked for the cervical and the lumbar spine, I assessed her lumbar as well. I'm going to go ahead and just check for the shoulder height symmetry and the iliac height symmetry. So you're going to go ahead and turn this way, go ahead and let go of your hands. I'm checking her shoulder symmetry height. Bilaterally, it's the same and equal on both sides. And then I'm checking her iliac crest symmetry. Bilaterally, it's same and equal. I'm checking to see if she has any crests underneath her hips, which is goes to show me if she has any posture problems. And I don't see those, so I see the skin creases below her buttocks. I'm just verbalizing that, so that's equal in there. So symmetry wise, patient has flexes and extends, and one shoulder over the other is her shoulders are not elevated. So I see the inspection part of that, and then I've already palpated it as well. Palpated her back as well. So that completes that. And then next we're gonna go ahead and just kind of, I've already checked the smooth curve of her spine. So I've already assessed for that. I've already palpated it, and we've already percussed the spine using the ulnar side of my fist. So I've already done that as well. And now we're gonna go ahead and just do some range of motion for her spine. And I'm gonna have her basically stay in this position, and you're gonna go ahead and bend to the right for me, and then bend to the left. Perfect. And bend forward, and then go ahead and bend back toward me. Yeah, perfect. All right, thank you so much. And then I'm gonna have you lay back one more time. We're just gonna do a specialty test, and then we'll be done with everything. So you're gonna lay back down, and for the spine specialty test, it's called the straight leg raise. And we're gonna have her raise her leg all the way up. Straight. Yep, can you do that on your own? Can you hold it up on your own? Perfect, and then go to the opposite side. And this basically indicates to see if she has any abnormalities with her spine. You can go ahead and put it down. Any abnormalities with her spine, if she's reporting any pain or tenderness, saying that her lumbar is not as healthy as it should be. So since she did that with no problems and she didn't report any pain or tenderness, this actually completes our exam. You can go and sit back down. Thank you so much for your time, and I hope to see you next time.